Pathobusters presents Mumps, Battle for the Parotid Glands. Mumps is a disease that's making a comeback. To defeat your enemy, you must understand it. Would you like to know more? Let's begin. We will be covering the causes and history of mumps, what someone with mumps will experience, how to deal with mumps, and what you need to know to stay safe. Well, there it is. Not too pretty. Mumps is a viral infection that causes your saliva glands to swell up. In the past, most people thought that mumps was just a normal part of growing up, like losing your baby teeth, or crippling social anxiety. In 1988, mumps was found to be, in fact, a disease. Shocking. The virus is spread when someone is exposed to the saliva or respiratory droplets of someone who is infected. The virus spreads to the back of the unknowing victim's throat and to their nearby lymph nodes and saliva glands. Symptoms begin 12 to 25 days after exposure and last 7 to 10 days. If you have a headache and fever for 1 to 2 days, an earache, painful chewing and swallowing, swollen saliva glands, you might have mumps. Sometimes the virus can travel to the testicles and cause swelling and, well, pain. At least it only lasts a couple of weeks. Let's learn about treatments for the symptoms of mumps. Once you have mumps, there is no direct treatment, but we can make the experience a little more bearable. If you have mumps, stay home and get plenty of rest. Drink lots of fluids, but avoid sour beverages because they can make your saliva glands more swollen and painful. Eat soft or pureed foods like bananas or applesauce. And take some ibuprofen or acetaminophen to relieve the pain. Use a cool, wet cloth to soothe your swollen neck and face. Gargling salt water can reduce swelling too. How can we stop the spread? The most important thing to do is to get the measles, mumps, and rubella vaccine. This will make you immune to the disease. As long as you have symptoms, you can infect others, so stay home and avoid contact with people outside your home. In your home, avoid sharing utensils or cups, or kissing. Saliva carries the virus. If you suspect you have mumps, see a doctor. If you develop a fever, become confused, lose consciousness, or have trouble eating or drinking, contact your physician. Now you know about mumps, and knowing is half the battle. See you next time.
Created using Powtoon.